I have 2 beautiful daughters, 14. Sophie is 14 and Mary Elizabeth is 12. And then almost 7 years ago, I married Mike. So I was a single mom up until that point. So essentially I've known that, something just wasn't quite right even as a child. But bipolar 1 is what I have or what I've been diagnosed with. And so you go from real highs, which are considered manic, to severe, profound depression. And without medication and other treatment, there's no in-between area, gray area, happy area, good area.
So Shanda was 26 years old, and she was actually admitted to the inpatient unit here at St. Joseph's Hospital for a severe depression. And at the time, the treating psychiatrist was very concerned about her depression and decided that ECT might be a good option. She was about 9 weeks pregnant, and just backing up a little bit, she had been previously hospitalized at a different place for a severe depression. There she was found to be pregnant. So a pregnancy was diagnosed at that admission, probably a month or 2 prior to her coming to us. So the psychiatrist there then discontinued her medications very abruptly because she was pregnant, which is usually a knee-jerk response that we've seen over the years for pregnant women. She was then discharged and continued to deteriorate, and so was referred to our hospital here.
So my first pregnancy, I worked full-time, I think even 2 jobs through the pregnancy, was monitored very carefully with my medication, but I did fine and had a healthy baby, and that healthy baby's 14 now. And then 2 years later, I was not in a good spot to begin with. Became pregnant and was in and out of the hospital, the psychiatric hospital. Having a severely depressed mother wasn't good for that unborn baby.
The decision for ECT was made because she was acutely, severely depressed. She was pregnant, and there was concern that medications would not work as quickly, and we had fewer options for treatment at the time.
I want to say when I was pregnant with Mary and I was getting ECT and I was extremely fragile, that they treated Mary and I like China dolls. They were just so kind, and even when I wasn't pregnant, the kindness and compassion that they showed was just amazing.
So electroconvulsive therapy, I think in lay terms as shock treatment, is basically the process of administering or creating or giving an electrical stimulus to the brain via electrodes. That generates a seizure or an electrical activity in the brain, and that leads to a resetting or a rebalancing of the neurotransmitters and physiology within the brain that helps treat the mood disorder.
What impresses me the most is the collaborative approach that the physicians and providers at Marshfield Medical Center took. They just took me under their wing. I felt that way. I felt cared for, and I felt like I didn't have to worry. I was never treated in any way other than just completely respected, as a woman and as a patient. So I believe that without the intervention of ECT, I would have committed suicide because I was so profoundly and just suicidal, and didn't see any other way. So I do believe that it saved my life several times.
We've had a lot of scientific, systematic studies done on ECT. It's well researched, it's well regulated, it's done in a safe environment. It's done in the PACU, which is basically the offset of the ORs, under anesthesia with physicians, nurses in attendance, and it is extremely safe.
And then we were able to discontinue them And I did continue them with Dr. Shaw through the rest of that pregnancy and had a healthy baby girl full term. I would definitely tell anybody who's struggling that just don't give up hope, because it will get better. It will take some time, but it will get better. It always did for me. It always has, and I believe it always will. But the biggest thing is don't let a mental illness define you, because you're better than that.